everyone. Welcome back to my channel Navjot Talks. This is Navjot. I'm a registered nurse in Ontario, and those who know me, I am the one who posts videos on my channel to help the international nurses to just take their journey in a smooth way for some career advancement. I share whatever I have gone through. I share what other people shared with me. So all my videos are based on the experience. If you haven't subscribed to my channel yet, don't forget, because when I post any videos, you will get notified. And if you want to know what I post and you want to keep listening to my videos, keep watching them, please don't forget to press the bell icon. Somebody asked me in one of the comment section that they want to know about the courses that can be taken by the registered nurses once they have their license to practice as nurses in Canada. So I live in Ontario, so I'll focus more about the Ontario programs and courses because I have information about them. But if you would like me to make a video about British Columbia and Alberta, I would be very happy to help you, but I need some time to gather some information. I will make this video in two parts. This video will deal with the courses. I'll give you information about the courses and the programs that you can take just to advance your career so that you can, it will just open doors for you. Some doors that will lead you to a different path based on your interest. The second video will focus on the programs and the courses that you can take if you're planning to move from your home country to Canada, and you know that you have to come on a study permit, study visa, so you have to pick up some courses that are related to nursing. So those will be the program that you can take. Let's focus on what we are talking about, the programs and everything. Let's talk about them. There are many programs, there are many courses that are available for free. CLRI is one website where you can go and you can take a lot of courses free of cost. You just need to create an account over that website, and then it will open door for you for 10 plus free courses. Those who are working in the long-term care home sectors, I would advise you, please take all those courses, start increasing your knowledge, because those are important tools that you can use when you're working in the long-term care homes. It will also increase your chances to get hired in the long-term care homes, because those are the strategies that you must be using when you're working in the long-term care. How to handle the phone calls in a professional way, the family phone calls that are coming for the residents, how to use a huddle tool to communicate with the families, how you can take care of the pain, of the residents, how you can take care of the falls, how you can prevent the falls to happen in the long-term care home. Those are the courses that you should be taking, and they're free of cost, right? Let's just talk about more courses which you have to pay for, and then you can really excel in your field, because those are the specializations. One program that I have been hearing a lot about is nurse cosmetic injector, right? Cosmetic nurse injector, sorry. This is one of the program designed for those nurses who are very eager to join the cosmetic industry. They have this passion to administer Botox injections, some help in lip surgery, and basically the the beauty and the cosmetic part. Now, one thing that you must remember and you pay attention to is nurses who are only the registered nurses in Ontario, they cannot just give the Botox, they cannot just administer the Botox without prescription. You must have a prescription from a physician or a nurse practitioner for you to administer that product. If you are able to afford $3,000 to $4,000 on this program or course, it will open doors for you. You can work in the clinics, cosmetic clinics, you can work in the spas, you can work in the microblading, some treatments related to the beauty. They will teach you anatomy of the face, they will teach you how you can safely administer those products. People are very much concerned about their beauty, the wrinkles, and how they can look young and how they can age gracefully. So this is something, if you're interested in, you can take this course. I called few colleges to find out how much they're going to charge. It's $3,000 to $4,000, but it really depends on what you're looking for. Sometimes they have a full package where they will teach you everything about the face, every procedure. But again, you have to have an order. Now there's one trick. If you have a passion to become a nurse practitioner, this is a course you should take, and then nurse practitioners can also give orders. So you will be the prescriber and you can administer the medication too, right? So this is for those. Now the another course which is also very famous and people have liked it is nursing management and leadership. If you are an RN working in the long-term care home or a hospital and you have a passion to switch to the other side of nursing, that's the leadership, you can go for this course. If you are an international student and you have already passed your NCLEX, you have been in the sector for about 4 or 5 months, you can go for this course. It will just open doors for you to learn about leadership styles, and later on, whenever you are permanent resident, you really not looking for permanent residency, and you know that you are stabilized a little bit yourself, so you can pursue this one. So this is something which you can look for, right? How much you have to spend, it really depends upon your permit. If you are a permanent citizen, if you're a permanent resident in Canada, then you might have to spend less. But if you are on an international study visa, based on my experience, I can tell you the fee is really high these days. You might have to pay $10,000 or more than that. But it's a program that's for 8 months, and you can go to small campuses, you can go to small colleges, I mean the small campuses of the colleges, and then you can have the certificate. Another program that I would like to talk here is dialysis. A lot of the nurses, they have this passion to work in the dialysis clinic. Now it's like the patients, the residents, they come on daily basis, like however their schedule is, they come and then they leave after a few hours. So it's kind of like a fixed schedule that you might get. You can work 7 to 3 shift, 3 to 11. Based on my experience talking to some people who are working in the dialysis clinic, they have given me some information that it's a fixed schedule that you have to follow. And so if you're looking for something that's a fixed schedule, you can go for this one. One more thing you have to understand is the working schedule in the long-term care sector is a little bit different than the hospital. In hospitals, majority of the shifts are 12-hour shifts, and on rotation basis, 1 week or 2 weeks you will be doing night shift, and then later you will switch to the day, right? In the long-term care home sector, mostly it's a fixed schedule that you will be asked to follow. For example, you're working 7 to 3 shift, 3 to 11 shift, and you have a fixed schedule. You'll be off on certain days, and it will repeat after every 15 days, right? So you have to understand what is your passion about. My passion was management and leadership. I always wanted to become a leader, because I personally feel that when you have a vision to make a change, you should go for this one, right? Another program that you can do is cardiology. I have seen people coming from their home country taking admission into different colleges, very famous colleges. I can tell you some: Niagara College, Seneca College, and Humber College or Centennial College. And mostly I have seen international students coming to Niagara College and Seneca College and George Brown College, right? So these are Conestoga, very famous. So these are some of the colleges where you can go and enhance your skills into cardiology, right? If you want to work in the cardiac unit, you have this passion, you have experience from back home, and you want to really enhance your skills in this department, you should go for this course. Now, some people only want to work in the long-term care home sector or in the senior department, like the senior, where the seniors they come in the hospital, senior mental health unit, or any kind of setup where seniors live, retirement homes. They can also go for palliative care nursing. That just tells you how you can help people who are in the end of their life or in the palliative phase, which is also a huge component in the long-term care homes. Not everybody end of life is a palliative person, and doesn't mean that everybody who is a palliative is on end of life, right? So you can also go for this one and then use all those skills. Another thing that you can do is you can also become BSO RPN. If you are RPN in Ontario, registered practical nurse, and you have some passion to deal with clients who have behaviors, unmet needs, you can go for that. RPN BSO, right? After that, it might open an opportunity for you to become a GPA coach, gentle persuasive approach, how you have to push the clients who have behaviors, who have unmet needs, the behavior that are not able to be managed by the normal staff, right? Regular staff, they can teach some techniques. You can become a coach in that as well, right? So you have to do some homework today. You have to start thinking what is your passion. Don't just pick up anything because there are opportunities. Opportunities will automatically come. Doors will automatically get open for you once you have it on your resume. Trust me on this part. If you have passion about cardiology, just stay there. If you have passion about cosmetic, just stay there. Leadership, just stay there. I have BSc nursing and leadership management certification, and I'm working as associate director of care. And the only thing that has helped me, I will tell you very honestly, I kept on adding certificates to my resume and I kept on learning and then sharing that further with my RNs, with my RPNs who are working with me, the team that I'm leading, the team that I'm supervising on a daily basis. It helps me to understand where I'm lacking. And then I go and take up another course. I go and take, okay, this is something which I need to learn more about, right? It helps you for your own analysis. It's very important that you analyze yourself where you're lacking. You can't help others if you don't know how to help yourself, right? If you're working on the floor, you don't know how to perform certain procedures, you won't be able to lead the people because they will look for you. You have to be the mentor, right? So these are the courses that you can take. In the next video, I'll talk about the courses that you can take if you're moving from your home country and then you want to pick up some programs affordable, and you also want them to be considered during your application for NNES, for your application for CNO. That will help. One piece of advice I like to give you at this moment is, even if you're not registered today, you should start taking these courses which I mentioned, some of the free courses that I mentioned, because they will help you to crack the interviews. You have to sell yourself during the interviews. Don't just sit free, because sometimes we have some gap. I graduated from India in 2016. There was a gap, but that gap was filled because of education that I kept on adding, some certificate that I kept on adding, and then started as an RPN, then became an RN, then ADOC. So you have to focus on what you're doing during your gap time. If you're on mat leave, take advantage of these courses. You can still sit and do some free courses, right? So by the time you're back in your field, by the time you're ready to step back in your field, you know that this is something which you upgraded. And there's one question which majority of the recruiters will ask you, majority of the people who are interviewing you, they will ask you, what have you done in the last 1 year, what have you done in the last 5 years to enhance your skills? And you should have an answer for that, because you want to show that you're not just sitting wherever you were sitting 5 years ago, right? People, there's a competition, people are growing every day, people are adding certificates into their resume. You have to do the same thing. Okay, see you in next video. Until then, take care, stay tuned, don't forget to share my videos. If you like my videos, please motivate me, because it helps me to make more videos. Thank you, bye.